In this video, we're going to go over using AI to help you write the evaluation note. So here I've made my templates. I like this one. I've made, you can alter the instructions. If you click here, you can just edit what you want it to say. So I've done this and then made it my own template. And then so this is gonna be for a dictation note. Other options are you can record it the subjective, or you can record your patient exam and then it will fill out this. Sometimes I use that for just the subjective section. The section of the note will be recorded during the session. When you do that, you just have to make sure that you inform the patient and get their consent. So this will be for dictation. So I'm going to hit record. Patient presents primary diagnosis, vertebrogenic low back pain. Symptoms are both on the right and left side. This started about a month ago when the patient lifted a heavy box from the floor. Since this happened, the patient describes a dull, achy sensation in his back. At worst, this pain is an 8 out of 10. Currently, the pain's a 4 out of 10. At best, the pain's a 1 out of 10. He describes his pain as dull and achy. Past medical history is relevant for high blood pressure. There are no complicating factors affecting the plan of care. Functionally, the patient's limited with lifting anything more than 20 pounds from the floor. He's limited with lifting his child. He's limited with any activity that has a higher impact, such as walking on uneven terrain and hiking. He has difficulty with twisting motions. His back pain's worse for the first hour of the day, and this makes it more difficult for him to get ready for work in the morning. The patient denies any symptoms in his leg. His modified Oswestry, OSWESTRY, low back pain shows 53% disability. If it's a more complicated word, then I spell it out so that way it gets right in the system. Lumbar flexion 30 degrees, lumbar extensions 15 degrees, lumbar right rotation 10 degrees, lumbar left rotation 15 degrees, right lumbar side bending 10 degrees, left lumbar side bending 15 degrees. Lumbar extension strength is 4 out of 5. Myotomes, dermatomes, reflexes are all normal. Our plan of care will be for 2 times a week for 12 weeks. Treatment will include therapeutic exercise, therapeutic activity, neuromuscular re-ed, manual therapy, patient education, self-care strategies, modalities as needed for pain relief. In today's stretch session, we did some therapeutic exercise. We did the Thomas stretch on both sides. We did a prone quadricep stretch. We did hip internal and external rotation stretching. Neuromuscular re-education. We did resisted pelvic tilts in sitting, in supine, and with trunk flexion. Manual therapy. We did graded lumbar mobilizations in the prone position. Therapeutic activity, we worked on hip hinging with no weight added. We worked on bending forward and returning to a fully erect position. All right, so we're 3 minutes in. I got everything I need. I hit the stop button. I wait for everything to load. Everything's complete, and then I hit comprehend. And then it fills it out for us. Here's our assessment. It gives us goals. The system will delete that for for daily notes, so I add in patient will be independent with their home exercise program for the first goal, and then list the other goals after that. So that way these don't delete when you do your next daily note. And then for the daily note portion, I switch over to daily note 1, which is this template I set up for daily notes, and then I hit comprehend. And then here, everything I said out loud, all the objective measures gets put nicely into this box. I have it for future reference. I usually delete these boxes. Here you can see my treatments. So taking these out because these were not under therapeutic exercise. The NeuroReeds all correct. Manual therapy is correct. And then the two components of the therapeutic activity are correct. And that's all.